Good afternoon. Today we will see about Atlantooccipital joint. Okay. So Atlantooccipital joint. Before that, tell me about anatomy about atlas bone and then the occipital bone. Any idea? So normally, if we want to study about a joint, means in which order we have to study? We have to study about the type of joint. Then in that type of joint wherein articular surfaces, ligaments, muscular attachments are movements, and muscle responsible for the movements. Okay. So in that, if we see about the Atlantooccipital joints, means the articular surface will be okay. So articular facet of the occipital bone. So where will be present means in this occipital, inferior to the occipital means there will be a smooth surface. Okay, smooth surface present medially and laterally behind the occipital foramen. Okay, this one is the articular surface of the occipital bone, and then in this atlas there will be a superior articular surface, articular facet. This will articulate with the articular surface of the occipital bone to form the Atlantooccipital joint. Okay, and this atlas bone, it's not unique with any other vertebra, so it will be a different among the other vertebras. So what will be the different? There will be no spinous process, there will be no body, so it will be present in a oval shaped one. Okay, so in this atlas bone there will be a superior articular facet, inferior articular facet, then one pedicle, one lamina, then two transverse process, one intervertebral foramen. Okay. So along with this Atlantooccipital joint, there is one more joint will also present. That one is called as the Atlantoaxial joint. Why I am teaching about Atlantoaxial joint also means for a movement, there is no separate movement between Atlantooccipital joint. So the axis bone will also helps in the movement of the Atlantooccipital joint. So that we have to study about the axis bone also. So this axis bone is called as the second cervical vertebra. So in this axis bone also, it is also not similar with any other vertebral bone. It is different from other vertebral bones because it has a odontoid process or dense process. So this process will be not present or not seen in any other vertebral bone. Okay, but there also will be a spinous process. So here there is two articular facets, superior articular facets, and then the inferior articular facet. Similarly, there will be a intervertebral foramen. Then spinous process, then transverse process. Okay, and this axis bone, the odontoid process will be placed anteriorly and superiorly. Okay, and in front of the odontoid process, here also an articular facet. This articular facet will articulate with the atlas bone, and the inferior articular facet will articulate with the superior articular facet articulate with the inferior articular facet of the atlas bone. And these both combinedly articulate with the occipital bone. So, and thus it will produces the movements of the Atlantooccipital joint. So, what will be the movements present in the Atlantooccipital joint? So, this odontoid process will helps in the locomotion of the Atlantooccipital joint. So, how means in this odontoid process will make the occipital into flexion or extension. Okay, like a horizontal axis. So in superior to this helps in the antero-posterior direction or anterior or posterior movement. Apart from anterior posterior movement, there will be lateral flexion and also rotation of the Atlantooccipital joint, and also there will be a combination of movement called as the nodding movement. So any idea about nodding movement? So repetitive movement of the flexion and neutral. So from flexion to neutral. Then in nodding movement there won't be a combination of extension, only flexion, then neutral. So this will occur as a result of the combination of both three bones. So this nodding movement is a normal movement or as an abnormal movement? Normal movement. So when will we consider as abnormal movement?
Extension.
When the patient is not able to control this movement. Once the patient is able to control this movement means it's a normal movement. Otherwise, when the patient not able to control this nodding movement and the patient is repeatedly doing this nodding movement means it it shows that there is it's a abnormal movement, and it may be due to any neurological pathology or any neurological diseases. Okay. So clinical anatomy or upper anatomy of this joint will be any idea? Any injury occurs in this level means it leads into the deformity, or this is called as the torticollis. Okay. Is it clear? Any doubt? Okay. Thank you.